Hello and welcome to this presentation on Primer for Local Education Agencies, LEAs, on Medicaid School-Based Services. This is Nicole Clark with the Medicaid SBS Technical Assistance Center. For today's webinar, we will cover the objectives and discuss more details around understanding the basis of Medicaid SBS. Then we will move into a discussion around identifying how schools can promote student access to Medicaid SBS. We will then move into a panel discussion with representatives from New Mexico LEAs on how they are working to increase access to Medicaid SBS. We will then conclude the session with a short Q&A and review some resources associated with the content of today's presentation. By the end of this webinar, you should be able to understand the basis of Medicaid, including the federal/state Medicaid partnership and the authority allowing school districts to obtain Medicaid reimbursements for services under an individualized education program, an IEP, and the Center for Medicare and Medicaid Services. The current requirements under the Individuals with Disabilities Education Act, IDEA, and Medicaid for services to students with disabilities, ways to engage in state work to provide access to Medicaid SBS to all Medicaid enrolled students, including resources and solutions to support and promote state Medicaid SBS expansions, and finally, promote understanding of local education agency engagement through a panel discussion. Before we get started, if you have any questions during today's webinar, please use the Q&A feature located at the bottom of your screen to submit your question. With that, I will pass it over to Masuma to review the basics of Medicaid SBS.
Thank you, Nicole. So in order to provide some foundational knowledge, I'll be providing some high-level information for understanding the basics of Medicaid school-based services. Medicaid and CHIP provide health coverage to millions of people living with disabilities, low-income families, pregnant individuals, adults, seniors, and children, including over half of American children. While there's often overlap between Medicaid and CHIP coverage and benefits, they are separate programs that cover different populations. CHIP provides health coverage to uninsured children and families with incomes too high to qualify for Medicaid coverage, but too low to afford private coverage. Medicaid and CHIP are funded jointly by states and the federal government. Under broad federal guidelines, each state administers its own unique Medicaid and CHIP programs, with different eligibility standards, provider requirements, payment methods, benefit packages, and reporting requirements tailored to meet the needs of its residents. Children may also be eligible to receive health coverage through Medicaid or CHIP based on factors of eligibility, such as household income, unique healthcare needs, such as a disability or foster care status. Medicaid services can be provided to students in a school-based setting and can play a key role in the health of students. This is because the school setting offers a unique opportunity to enroll eligible students in Medicaid or CHIP, facilitate access to coverage, provide health services directly to Medicaid and CHIP beneficiaries who are students, provide an opportunity to meet students where they are, and to deliver services where children spend most of their time each week, and can compensate school providers serving students, lessening the need to use general education dollars. For LEAs, it is important to note that there's an opportunity to maximize reimbursement for services, as Congress allows LEAs to receive Medicaid reimbursement for health-related services on a child's IEP, and Medicaid is the payer of first resort for those services. This means that Medicaid will pay prior to federal IDEA funds for Medicaid-covered services in a child's IEP. Medicaid SBS began in 1988 when Congress allowed local school districts to receive reimbursement for health-related services provided to special education students. In 1997 and 2003, CMS had issued technical assistance guidances for claiming for SBS. However, in 2014, CMS issued a state Medicaid director letter which clarified that Medicaid payment is allowed for services covered under a state's Medicaid plan for Medicaid-eligible beneficiaries without charge to the beneficiary. In addition, the Bipartisan Safer Communities Act directed CMS to provide additional guidance to states related to Medicaid SBS. This led CMS to issue the 2023 Comprehensive Claiming Guide in order to level the playing field for states to better understand Medicaid reimbursement in school-based settings. You can find more information on the BSCA in the appendix section of this training. More specifically, the 2023 Comprehensive Claiming Guide provides guidance on Medicaid SBS that may be reimbursable if included in approved state plan amendment, or SPA. This includes helping eligible students enroll in Medicaid and CHIP programs, connecting students, Medicaid and CHIP eligible family members with health coverage, offering Medicaid and CHIP covered services that support at-risk Medicaid or CHIP eligible students, providing Medicaid and CHIP covered health services in schools, and performing state program administrative activities. Within a state's Medicaid structure, LEAs work closely with both the State Medicaid Agency and State Education Agency to administer the Medicaid school-based program within the parameters set by the SMAs. You can find the main roles for the SMAs, SEAs, and LEAs within the diagram shown here. The main roles LEAs play in administering the program include ensuring that a free, appropriate public education, or FAPE, is available to each eligible child, providing school-based services, and implementing SMA and SEA policies, Medicaid SBS procedural billing, and documentation. Providing SBS can be a sustainable source of federal funding for Medicaid enrolled children to access healthcare services within a school setting. And note that this does not apply for U.S. territories, as they have capped amounts of Medicaid funding each year. Providing SBS can also enhance identification of health needs and can connect students to a broad range of healthcare services, including mental health and substance use disorder services in the community, allow children to obtain primary and preventive services as well as other necessary treatments, and can expand the number of children who access Medicaid and CHIP. Overall, SBS providers can help promote health and educational equity and may increase school attendance. Here's an example of the steps LEAs can take in order to access Medicaid funds. Please note that accessing funds will be dependent on a state's approved payment methodology, and the example shown here is based on a cost-based reimbursement. Within this methodology, an LEA will begin by reviewing the state's Medicaid SBS program requirements. Then, LEAs will identify qualified service providers and Medicaid enrolled students. LEAs should obtain consent to bill Medicaid for SBS before providing and documenting services to Medicaid eligible students. Before claiming, LEAs should also contract with the SMA or third-party payer. Then, LEAs should prepare for billing and submit the claim to the SMA or third party who submits the claim to the SMA. LEAs then track claims to see if they've been denied or paid and dispersed by the SMA. The BSCA also tasked CMS and ED to establish this Technical Assistance Center that's designed to provide additional technical assistance, resources, and support to schools that will provide guidance on the federal funding available for school-based physical and behavioral health services. Specifically, the Medicaid SBS TAC will assist and expand the capacity of SMAs, SEAs, LEAs, and school-based entities to provide services under Medicaid, assist in the reduction of administrative burden, provide support to SCAs, LEAs, and school-based entities in obtaining payment for the provision of assistance under Medicaid, ensure ongoing coordination and collaboration between the U.S. Department of Health and Human Services and ED with respect to the provision of and payment for assistance under Medicaid by LEAs, and provide information to states and LEAs on how to utilize funding. And with that, I will turn it over to Charlotte to discuss how LEAs can facilitate greater access to Medicaid SBS.
Thank you, Masuma. Now we will explore what facilitating student access to Medicaid SBS looks like from an LEA perspective. Medicaid and CHIP programs are intended to provide healthcare funding to support services to students and children in need. The federal guidance that we mentioned before defines these areas of healthcare for students. And for LEAs specifically, a student's access to Medicaid SBS can be accomplished through early and periodic screening, diagnosis and treatment, EPSDT services, funding, special education and related services included within Medicaid to children with disabilities through a child's IEP, promoting mental health care, and addressing health equity. We will take a look at each of these areas a little more closely and identify specific action items or interventions LEAs can engage in to promote this access. Now, hopefully for some of the LEAs on this webinar, these steps will seem familiar, but we will also be sharing some important resources to reinforce your efforts and talk about programs to promote your work. All Medicaid enrolled children can receive a broad range of medically necessary services as defined in the EPSDT benefit, and those services can be delivered in schools. This promotes increased school attendance and better access to education, and the receipt of these services in school would not decrease the benefit. Now, providing these services in schools promotes one-stop shopping for healthcare services and increases physical health and better outcomes, such as graduation rates and economic contributions of future adults. For more information on the EPSDT benefit, please see the appendix section of this training. Examples of school-based services that can be identified within the EPSDT benefit include physical health services, such as screening, diagnosis, and treatment for dental, vision, and hearing problems, health examinations, immunization, well child care, and chronic disease management, physical and occupational therapy services, and speech pathology and audiology services. Mental health and substance use disorder services include screening, diagnosis, and treatment for mental health and SUD, and prevention and early intervention for children with and without diagnosed mental health conditions. For the EPSDT benefit, LEAs can ensure proper student identification for the benefit and identify a plan for service provision, basically the who, what, when, why, and how of EPSDT for your school. For more information, please visit the Early and Periodic Screening, Diagnostic and Treatment Medicaid webpage. This site is intended to help states, healthcare providers, and others to understand the scope of services that are covered under the benefit so that they may realize the goals of the benefit and provide the best possible child and adolescent health through their Medicaid programs. Now let's take a look at how students access Medicaid SBS through funding special education and related services included within Medicaid to children with disabilities through an IEP. Under IDEA, students with disabilities have an IEP that includes special education, related services, and supplementary aids and services. Funding special education and related services is included within Medicaid to children with disabilities through a child's IEP. Some services, such as speech therapy, occupational therapy, and mental health, are eligible for funding under Medicaid. IDEA services must be individualized to the child and delivered at no cost to the child's family. Parents must provide informed written consent for personally identifiable information to be shared for the purposes of Medicaid billing in accordance with IDEA and the Family Educational Records Privacy Act, FERPA. IDEA also requires that prior to accessing Medicaid and annually thereafter, there must be written notification to the child's parents regarding the LEA's use of Medicaid and their rights under IDEA and FERPA. For more information on IDEA, please see the appendix section of this training. So what can LEAs do? It's important to really understand how SBS works in your state. Many states have websites that include a number of resources to help understand how special education funding works. Developing systems to compile necessary data to submit claims can also help LEAs ensure timely reimbursement. Established protocols and policies can help schools engage in the proper steps to submitting claims. Be sure that schools know how to obtain parental consent and inform parents of their rights when accessing Medicaid. Now let's look how LEAs can promote mental health care through Medicaid SBS. To begin, let's get a better understanding of this problem. There is an urgent need to identify children and adolescents who are at risk for mental disorders, including SUDs, and to connect these children and adolescents with other services they need. 10% of children and adolescents have serious emotional disturbance, and 80% of those do not receive needed services. 80% of children and adolescents with mental health diagnoses have unmet mental health needs. Now, children are 6 times more likely to complete mental health treatment in schools than in community settings. And mental health services are most effective when integrated into a student's academic instruction. Early access to appropriate mental health and SUD services conducted by comprehensive school-based mental health and substance use treatment systems have been associated with enhanced academic performance, decreased need for special education, fewer disciplinary encounters, increased engagement with schools, and elevated rates of graduation. To help address this issue, CMS and the Substance Abuse and Mental Health Administration, SAMHSA, issued a joint informational bulletin to address mental health and substance use issues in schools. This bulletin identifies best practices for addressing behavioral health and SUDs. It identifies the Medicaid authorities that states may use to cover mental health and SUD services, and offers multi-tiered models for implementing mental health and SUD services. To help states, the TAC offered a presentation and virtual meeting to discuss the multi-tiered system of support and provide concrete examples of how states have implemented partnerships and policies to promote this work. You can view those slides and the recording of that meeting on the Medicaid and School-Based Services website under the TAC Past Events page, which is also linked here. SAMHSA partners with SMAs and schools wanting to expand the use of the 988 Suicide and Crisis Lifeline that is available to anyone experiencing suicidal, substance use, and/or mental health crises or any other kind of emotional distress. For more information, please see the additional resources section found on the TAC webpage, linked here. It has been found that addressing mental health and SUD issues within schools have proven to increase 988 calls, reduce 911 calls, reduce emergency room use, and support better access to education. Mental health and well-being is a priority to the U.S. Department of Education Secretary, Dr. Miguel Cardona. The goal is to invest in every student's mental health and well-being by increasing school-based health services for students and building schools that support students' overall well-being. The department is committed to working with parents, families, educators, and others to meet students' mental health needs. And ED is assisting states and local leaders to grow the knowledge and skills of professionals currently in schools, expand the supply and capacity of mental health professionals who can work with students, and increase access to funding through Medicaid programs to support school health services, including mental health services. Let's discuss a couple of resources available to promote that work. The Office of Safe and Supportive Schools, OSSS, addresses the health and well-being of students, school safety, security, emergency management, and preparedness. They do this primarily through the administration, coordination, and recommendation of policy and grant programs, and by providing technical assistance centers addressing the overall safe and health of school communities. We recommend taking a look at that site to find information on grant programs that address violence prevention, school climate, and mental health services. Additionally, there is a publication put out by the U.S. Department of Ed called Supporting Child and Student Social, Emotional, Behavioral, and Mental Health Needs. Now, this resource provides more focused information, recommendations, and additional resources to enhance the promotion of mental health and social emotional well-being among students. Recommendations provided within this guide address topics such as enhancing mental health literacy, evidence-based prevention practices, and enhancing workforce capacity. Now, what can LEAs do to promote the mental health of their students? Utilizing the resources we just discussed can support your efforts, but LEAs need to identify the current mental health service needs. And once those needs are identified, then secure mental health provider access for students. Then develop a plan to address mental health crises and needs as they arise. Addressing health equity is also a serious challenge for LEAs. Let's explore that topic. It is understood that by increasing access to Medicaid SBS, schools can help promote the health and educational equity in their schools. Children from low-income, racial, or ethnic minority populations in rural communities in the United States are less likely to have a conventional source of medical care, and they're more likely to develop chronic health problems. Many of these children are already enrolled in or are eligible for Medicaid, and 37% of school-age children and 79% of school-age children living in poverty receive coverage through Medicaid and CHIP. It was also found that in 2019, 2.3 million children were eligible for, but were not enrolled in Medicaid or CHIP. Compared with children who are uninsured, children who are enrolled in Medicaid were more likely to do better in school, miss fewer school days due to illness or injury, finish high school, graduate from college, and earn more as adults. Medicaid SBS allows for the delivery of needed medical services and helps children overcome educational obstacles in school. Schools can play an important role in bridging equity gaps among students in low-income and rural communities where access to healthcare services may be more limited, and many of whom are already enrolled in or are eligible for Medicaid and CHIP. To help address the gaps in health equity, the Health Resources and Services Administration, or HRSA, provides funding to expand school-based service sites. The purpose of these awards is to expand the access to primary health care services, including mental health, through the Health Center Program Award to recipients, new and/or existing service delivery sites located at schools. In 2023, a total of $2.5 million was awarded, and awards were provisioned for proposing a new site or expanding an existing site. The current performance period is 2 years. However, awards could be extended based on performance and availability of funds. Now, what can LEAs do? As we established, not all students who are eligible for Medicaid are enrolled. So LEAs should establish protocols for periodic Medicaid outreach and enrollment activities based on data collected by schools. LEAs can also increase the access to healthcare by addressing social determinants of health and other social issues. Now, it's important to develop partnerships to expand access, and much like what was promoted by the HRSA School-Based Service Expansion Award. Now, with that, I would like to turn this back over to Masuma.
Thank you, Charlotte. Now I will briefly go over the path forward for LEAs to promote access to Medicaid SBS. We want to promote states to engage in the work to moving to offer more healthcare services to students in schools. This can be an incremental move from only offering services to stay compliant with IDEA requirements to adding in an additional service or two, or a full move to expanding SBS. Note that this diagram of increasing Medicaid SBS adoption refers to all states and DC. To CMS's knowledge, none of the territories claim for Medicaid SBS. What is important to remember is that states need to understand the goals and requirements of Medicaid SBS as outlined in the 2023 Comprehensive Claiming Guide. This leads states to consider what changes need to be made and to start drafting policies to allow for all Medicaid eligible students to receive medical care. Most states should submit a SPA for approval to fully expand SBS. In order to better understand how Medicaid SBS expansion has occurred across the United States, this slide discusses states' expansion and Medicaid SBS expansion. As of January 2024, 16 states have fully or partially expanded their Medicaid SBS programs and have a CMS-approved SPA. The remaining states have not taken formal action to implement or align their state Medicaid plans. And note that LEAs do not have to implement every service outlined in the state plan and can decide which services they would like to implement in their schools. For LEAs in states that have not taken formal action to expand Medicaid SBS, the path forward includes providing services to ensure FAPE and working to increase the number of LEAs participating in the existing SBS program. LEAs can do this by empowering and educating school staff on the importance of their role in administering Medicaid SBS. School districts may feel overwhelmed, but sharing the need and benefit of this work to align with the goal of improving student health and education outcomes is needed to understand the relevance behind participating in the existing SBS program. LEAs can also work to understand how to provide more existing services by identifying the current services provided to students within school settings and identifying the needs of students. What service needs are not being met for students? What does a school or district need to support and meet the needs of students? What resources would be helpful in addressing the students' unmet needs? This information can be used to develop a resource that helps SEAs in the comprehensive review and analysis and overall help to understand the current Medicaid SBS landscape and gaps in covered services from an LEA perspective. LEAs can determine what would be feasible to increase students' access to Medicaid by ensuring reimbursement is provided for services already being offered, ensuring compliance with state mandates and policies, and ensuring FAPE is being provided. And lastly, making your voices heard by getting involved in conversations with your state decision makers. Identify the contacts for your SMA and SEA that are working on creating Medicaid SBS policies and connect and establish working relationships with them. Ask your questions about where the state currently is in its efforts for expansion of services, and share your suggestions and concerns on the feasibility of administering SBS. This will bring the right people to the table to inform and decide on the state's implementation and evolution plans. As mentioned, the SEAs work to develop the Comprehensive Review and Analysis, or CRA, which aims to bring together information regarding the current state of Medicaid SBS in the state. This is important as it informs the policy and service provisions for Medicaid SBS, identifies issues with implementation of current policies, and identifies gaps in addressing student health needs. This is greatly informed by the input of LEAs and provides a great opportunity for interested LEAs to get involved in state-level decisions. It is also necessary and important to understand the provider gaps and staffing shortages. As you can see, the recommended provider-to-student ratios across varying roles, such as school counselors, school social workers, and school psychologists, is not being met across states and the national averages. While there's variability among states, these ratios highlight the need to address these gaps and shortages and work towards ensuring that student health needs are being met. For LEAs in states that have taken formal action to expand Medicaid SBS, there are opportunities to learn what expansion looks like and to strengthen leadership and collaboration. LEAs can understand states' expansion for SBS by identifying if the state submitted a SPA or passed legislation and what Medicaid coverable services and administrative activities are eligible for reimbursement. Some resources that may be helpful to review include the State Medicaid Plan, SPAs, State Medicaid Manuals for LEAs, and administrative claiming guidances. Understanding the policies in place in your state that have been created or revised is critical to expanding and streamlining Medicaid reimbursement. You can also identify existing partnerships LEAs have fostered within the state. What community partnerships are in place? Who is billing and who has the capacity to provide services? And how are partnerships established between providers and schools? Are there formalized agreements or a memorandum of understanding between these agencies? And lastly, LEAs can identify the state's service delivery models for Medicaid SBS. Medicaid Direct Care SBS can be delivered using different service delivery models. Generalized service delivery models can be used for general healthcare needs, and specialized service delivery models can be used for specific conditions. Some states may also offer telehealth modalities as an option for delivering a covered Medicaid service for Medicaid-eligible children. As previously mentioned, LEAs provide a unique perspective on school-based healthcare needs and support SMAs and SEAs in the development of the CRA through data sharing and illustrating what is happening in schools. By identifying what services are being delivered, what provider types are working in schools, and identifying how to assess unmet student health needs, LEAs can inform SMAs, SEAs, and other stakeholders on why Medicaid expansion matters. LEAs can also get involved in state-level decisions by actively engaging in the work and participating in state-led forums, committees, trainings, and other collaborative events. LEAs can also work to promote learning and dissemination of understanding by engaging in opportunities to inform and educate state leadership on what is happening in schools, connecting with national, regional, and local advocacy groups, and seeking opportunities to continue to learn and educate on Medicaid SBS. Lastly, in addition to working with your SMA and SEA, we encourage you to engage with our TAC for any support you may need regarding Medicaid SBS. You can contact us via our email at schoolbasedservices@cms.hhs.gov and continue to keep up with our future events and resources. Here's an example of how LEAs have gotten more involved in the state of Colorado. School districts are able to contract and collaborate with Colorado's SMA and Department of Education to create a local service plan that establishes the healthcare needs of its students, prioritize those healthcare needs through community input, and establish a budget for funding those needs. This collaboration occurred through stakeholder forums, monthly office hours, outreach to non-participating districts, and ongoing training and support. As a result, school districts in Colorado were able to increase spending in Medicaid outreach and enrollment, strengthen district ties with community resources, increase coverage for the total student population, and increase the total spending of health services across the state. For more information, resources from Colorado's process will be linked in the resource slide at the end of this presentation. We would like to highlight again that the TAC is here to provide support to SMAs, SEAs, and LEAs throughout the process of implementing Medicaid SBS. We hope to continue to support states in moving the needle towards greater student access to Medicaid SBS, developing resources for LEAs, and understanding the challenges and pitfalls to help mitigate issues and carve the path forward for Medicaid SBS expansion in all states. To conclude, we acknowledge that the work can be challenging, especially for LEAs across states who may be in different places when it comes to increasing students' access to Medicaid SBS. If you are new to Medicaid and don't know where to start, attending today's webinar was a great start to increasing your understanding for Medicaid SBS. You can continue to review Medicaid SBS trainings and reach out to your SMA and SEA for additional support. If you are an LEA only billing for direct services and no administrative activities, we advise you to continue to learn more about the claiming process and reach out to your state agencies. We also recommend reviewing the upcoming TAC resources, such as the FAQs and job aids on cost pools that will be made available shortly on the Medicaid.gov website. If you are also an LEA in a state that has expanded Medicaid SBS, but are still only claiming for children with IEPs, we encourage you to engage with national, regional, and local advocacy groups in addition to your state agencies and the TAG for the path to moving forward. And with that, I will turn it over to Nicole to facilitate our panel discussion for today.
Great, thank you, Masuma. We're excited to have with us 4 panelists today from New Mexico to provide an LEA perspective on what Medicaid SBS expansion looked like within their school districts. We're going to go ahead and first start off with a round of introductions from our 4 panelists. Elizabeth, would you like to kick us off?
Sure. I'm Elizabeth Tingley. I am the Medicaid coordinator for Las Cruces Public Schools. I'm also a registered nurse and have worked as a nurse in the schools. That's pretty much it.
Awesome. Mallory, I'm going to turn it over to you to introduce yourself.
Hello, I'm Mallory Geisler, and I'm the Senior Director of Accountability and Operations for Albuquerque Public Schools, and I work within the Student and Community Supports Division.
Anna?
Hi, I'm Anna Curtis, and I am the Behavioral Health Coordinator for the Bloomfield School District, a very rural, small school district in northern New Mexico.
And Amber.
Hi, I'm Amber Rivera. I'm the Medicaid specialist for the Southwest Regional Education Cooperative. We're down here in Deming, the bottom corner of the state, but we handle billing for about 44 charters and 7 districts across the entire state. So we got every rural little charter school or whatever you can think of.
Awesome. We're going to go ahead and launch into some questions that we have here for our panelists. One of the first ones we have is looking for, please describe the Medicaid SBS that are provided in your schools, or describe the vision or wish list to increase student access to Medicaid SBS in your school districts. And Elizabeth, would you like to kick us off here?
Sure. So the Medicaid SBS program would in the schools, we have both the services that are provided in an IEP, so your mental health, your OT, your PT, speech and nursing, and then we have also expanded our Medicaid in the state of New Mexico to include those students that have 504s and have individual plan of cares, that we focused it, expanded out to all areas, so SLPs and so on and so forth. But our main focus right now is mental health and nursing.
Great. Mallory, anything to add from when looking at your district?
Sure. So again, I'm with Albuquerque Public Schools. And so we're one of the larger school districts, or the largest in New Mexico. And so after referral and evaluations, the services we provide through the IEP are the SLP, OT, PT, social work, audiology, and nursing services. So both in-person and teletherapy are mainly for the SLP. And now we're including those non-IEP free care nursing services. So what we are looking at is the behavioral health services that are contracted out. So, and we are looking at our district on some other things that we can add as far as, our mental health services. We have approximately 12,000 students that are receiving IEP services, and around 7,000 of those are Medicaid. So we do have 400 plus related service providers, and nurses in 140 schools. So we are large, like I said, but we do also in our district have provider enrollment units. And what this does is we help enroll students in Medicaid. So we have 2 of our staff members that actually plan events and have events around this the city and try to help other families get enrolled in Medicaid, which in turn kind of goes back into the schools of students. We also have child finds. And one of the main things is that our school nurses are the ones that reach out to our families.
Awesome. Thanks, Mallory. Anna, you want to talk a little bit about for your district?
Sure. So being a much more smaller school district, we are not able to provide quite as many services. And we were previously, anytime a social work or nurse were meeting with a student, we were entering it into our system. It was me that came across some things with MSBS within New Mexico that I'm like, wait, hold on, we need to have some other things in place. We need to put care plans in. We need to have all of these things to be able to bill for those. So we started building that up. I would say my wish list item is a much better billing system for our students. We currently use Max Capture, and it does not have the ability to have care plans as far as I can find within Max Capture. And some other things. So we have to have things in multiple systems to meet the requirements of Medicaid for those students who do not have an IEP.
And Amber, I'm going to turn it to you to see if you have anything to add about the schools that you support.
Not much more than that everybody else has already said, other than some of our schools have kind of their own school-based health centers that do their own Medicaid enrollment stuff through them. I am certified to be a determiner, which each biller section has to be, but I haven't ever had to actually use that in my position, but I'm able to do it. So other than that, everybody else has pretty much hit the nail on the head with all of their answers.
Awesome.
I'm kind of all over the place with some of that, so.
No, that's great. Thank you all so much for kind of talking through those. Want to talk a little bit about what does Medicaid SBS billing look for your LEA? And Anna, why don't you go ahead and kick us off here for your district?
Since I had talked about my wish list item, so we currently have Max Captures, our system that we were entering all notes and service captures for students, and it's really more for IEP students. It doesn't really work as well for our students who are not with an IEP, but it's what we have, so it's what we are currently utilizing. It does not have care plan formatting within there or some other things. So in order to meet that requirement, we are completing that on a separate system and then uploading it into our student information system so that it's there if we were to ever be audited or have to provide those documents. But we are using the Max Capture system. Very brief. Again, I just wish that it had more abilities and that it was a more comprehensive system. But maybe that's something that when we get more funds from Medicaid billing that we can maybe look to purchase in the future.
Awesome. Mallory, would you like to talk a little bit about how the billing works within your district?
Sure. So we also use Max Capture, and I know that we do have some struggles as well. So we bill on monthly basis through Max Capture. We also use our student information system to house some of our data. So we sort of work simultaneously with both. And we actually bill bi-weekly. I mean, it's monthly billing, but we do it bi-weekly just because our district is so large. And that's for the direct services for the special ed students, the fee for service. Then we do the quarterly random moment time study. And that time study is posted to Fairbanks. And that is for non-direct services. So that's basically any additional income that we should receive on top of that monthly billing. And then lastly, we do the yearly cost settlement, and that is also posted to Fairbanks. And we have a team of staff. There's around 10 of us working and a manager. So we do have, you know, a little more resources to use. So it's quite the process.
Awesome. Elizabeth, anything you'd like to add?
For what it looks like in my district, we're using once again we use Civic Solutions Max Capture as our billing system and as a documentation system. So we have all of our providers utilizing that system. We do have our nurses billing, and Max Capture, when we expanded into free care, if it would like to say, what we're having our nurses do is, yes, they have a totally different documentation system, but what they're able to do is they can go into Max Capture and just put in the services that they provided. And we also have within their documentation system, all of that data is always obtainable for auditing purposes or so on and so forth. And so, for right now, and we have expanded to one person for mental health who is a social worker who straddles both IEP driven and individual care plan services, that is now utilizing our system. And within the system, our state and Max Capture work together to come up with the billing codes, the service codes. And so we have both that are non-IEP and IEP service code billing, so that they can pick which one for that gentleman, he can pick whichever one that he's utilizing at that same time. And same for the nurses, whatever services they're addressing, whether it's an individual healthcare plan that supports that with doctor's orders, or within the IEP services. So we're able to do both, and we are working very closely with what we call our regular education social workers to be able to expand and have them start utilizing more of the mental health portion of it. So I will say, since we have expanded, our reimbursement has gone up from the state. And we also participate in the Medicaid administrative claiming as well. And our vendor for that is Fairbanks.
Awesome. Thank you so much for providing all of that info. Amber, anything else you want to add? And if not, we're going to go ahead and jump into that third question here.
No, go ahead and jump onto that, because
Cool.
Liza definitely, or Elizabeth, sorry, I know her as Liza, basically mirrored what I would have probably said. So
Great. So like you all have mentioned, obviously New Mexico is a state that has expanded their Medicaid SBS. And just thinking a little bit about that expansion, want to see everyone's thoughts here on the panel on what factors or key decisions do you think that led to successful implementation of Medicaid SBS? And Elizabeth, would you like to kick us off here?
Sure. What I would say is, with the state's decision to expand our Human Services Department to expand, our open communication between the LEAs and our Office of School Health have continuous open communication. And so what the Office of School Health did is came together and picked a group of us as they were working through the expansion. And so we had that input into what that expansion looked like. I mean, they had to follow the rules and regulations, but of us being able to provide information and needs that we need at the LEA point, as to make it viable in the schools, instead of it just being, okay, well, you guys can do that, but we're not going to do that. And they have been with us every step of the way, and they continue to provide education, trainings on how to implement that expansion in the schools. So that's how it looks for me.
Great. Amber, would you talk a little bit about some of the key items you think that has helped with expanding SBS or you found to be helpful?
That one's the tricky question for me.
Okay.
Because I haven't been as much part of like the decision-making part of things. So I guess since we're not one of the, I mean, yeah, we're bigger of when it comes to having so many schools, but the bigger districts seem to have, I guess, in a way, more of a input on what things help. And of course, it helps us too, their decisions. I haven't needed to like put my input in there too much. So I don't really have much of a factors for it. I can tell you like challenges is communication between like schools, our schools, like the people at the school versus, who we have to deal with or what we need to put in the system and all that.
Yeah.
The communication is our biggest challenge, getting each coordinator or sped director or whatever at each location to keep us updated on their changes, let alone what we need to help. Because if we don't know things are happening, the kids aren't getting the reimbursement. They might be getting the services, but they aren't necessarily getting the reimbursement on our side. So, but that's
Great. Thank you for sharing the challenge. Anna, any successes or challenges as also being from a smaller district you'd like to share?
I think the communication is huge. It was really myself and the special services director within our school district that really sat down and said, we could be getting more money. We're providing the services. What do we need to do? So we sat down and kind of watched several different webinars within New Mexico on the MSBS process and how to do that, sat down with manuals, worked our way through things. What do we need? What do we have to put in place? How are we going to do this? Where will we upload the documents? And how will we put everything together? And it was really just that communication between her and I. And I'm directly over all the social workers. So I really had that voice of how it would look on the day-to-day actual session-to-session documentation and how to make it as easy as possible for them because we are understaffed already. So we did not want to overwork our social workers and behavioral health people any more than they already were. But it was really just that communication and honestly having someone within the school district that's saying, yes, let's do this. What do we need to do is really great.
Great, thanks for adding that. And Mallory, what about you from kind of a larger district? Anything you'd like to add for successes or challenges with the implementation of Medicaid SBS?
Sure. So some of the key factors and decisions that led for us was one is the Medicaid state agency support, which I know, Elizabeth touched on as well, but their direction is very unmatched and crucial for us. It's also very important that we have district support, and that's including special ed and nursing services. So just holding, providers accountable for results and best practices. Another thing that is kind of tricky, and it goes with communication as well, but it's with department collaboration. So with the district our size, we're not just one small group. We have a lot of different departments. So it's very important for us to work with our finance department, technology, our business systems, making sure that our student information systems is working good. And like I said, special ed and nursing. And then of course, our provider buy-in. So that's the Medicaid School-Based Services requirements, making sure that they're clearly listed in the job description and what we're needed and what we need of them, kind of like what the expectations are. Also, trainings to providers available via webinars or in person or Google Meets, or it's just very important for us to make sure that we get that out to everybody, having training so that we're kind of all on the same page. And when things change or systems change or get updated, just having that user-friendly system for, documentation.
Awesome. Thank you so much for sharing. And actually, Mallory, I'm going to come back to you again just for this next question here, talking a little bit about what are the roles that school districts have allotted and or designated to aid schools in the implementation of Medicaid SBS. I don't know if you can touch on any of that or as your district, how you all have kind of set that up as well.
Sure. So I'm the Senior Director of Accountability and Operations So I'm over our Medicaid School-Based Services department. So within that, we have a Medicaid manager, and then we also have around 10 Medicaid technicians, and we have a coordinator as well in that unit. We also have related service liaisons. We have resource nurses that help. We have a Medicaid enrollment unit. And within that unit, there's a couple people, that's what I was saying earlier, that they help to go out and plan events and enroll students in Medicaid. We also have school-based health centers around the district. Those are primarily for high school students, but they could also be for middle and high. We have a fairly new program. It's around 5 years, which is behavior redirectors. And that's a staff member in every elementary school to help with behavior. We also offer the PIP program, which is the Parent Involvement Plan, and that's to help with some prevention and intervention, mostly middle and high schoolers. And then we also have contracted services that we do with some vendors around Albuquerque, and that's to help with behavioral health, suicide assessments, if they get referred out for mental health services. So those are some of the things that we outlined there.
Awesome. Thank you so much. Anna, would you like to talk a little bit about what you all have as some of the resources for this question as well for your district?
I think Mallory's just Medicaid team is bigger than like our entire administrative office in our small school district. So definitely just coming at it from a different perspective. I was hired on as the behavioral health coordinator. And I kind of saw this opportunity for MSBS and ran with it myself. So it wasn't really allotted or designated for me. It was just, hey, I'll take it on and run with it. We do, of course, have a Medicaid, I can't really call her coordinator, but she does all of our Fairbanks, and she adds students to Max Capture, and she also can enroll students in Medicaid and do all of those types of services. So we have her as well. And then we do have a family liaison within our district, and she wasn't really hired with Medicaid in mind, but she does help out with families, making sure that they have services. And she will hook them up with our Medicaid person that can get them enrolled if that is a need when she's working with the family. So we have like people who it's a little bit of their jobs, but it's not really a dedication on anybody. But that makes it much more of that team approach that we have to have within the smaller school districts. And we would love to increase what we are doing, but one of our biggest factors in not being able to increase is how short we are on providers at this time. So we would love to be doing more substance abuse groups and more mental health stuff within our district, but we are right now down 3 social workers, and we have people covering in every which direction. I'm actually, as a behavioral health coordinator, covering for 2 schools for social emotional services. And I can't personally do any more than what I am doing. I'd love to do a substance abuse group. I'd love to do a grief group. I'd love to do more, but that's our biggest limit right now. So if we could get more providers, we will definitely increase as we can.
Great, thank you so much. Amber, you want to talk a little bit about how you all are going about for the charter schools for the roles of Medicaid SBS?
Definitely. So here at the REC, we have 3 on our team. We all do everything, but specifically, like my role is to do the provider data, making sure everybody's enrolled and licensure is updated, turnaround documents are sent in. I also handle the Fairbanks part of things, the participant list, and making sure time studies are completed. And then we have Crystal, who is our financial specialist. She does the admin claiming part of it, making sure that RAs are looked over and rebilling's done if it needs to be done, or voided claims and so on. And then Christina does our data entry, our student information entry mostly. And of course, like I said, all of us do all of it, but like right now is admin, so we're all working on admin, and then or not claiming, whatever you want to call it. And then we all have our specific roles of sending reports to the schools and how they're doing. And we've divided up schools between each other to make sure everybody gets notified of their school's progress or lack of progress, whichever you want to go about. But that's about, excuse me, sorry, I'm a frog. That's about it right now, like for our district, our REC.
Great,
lot.
yes, for sure. Thank you so much. And Elizabeth, do you want to go ahead and jump into yours? And then I'm actually going to have you jump into a success story as well.
Okay. Okay. So the role of our Medicaid program within our school district, we are the second largest in the state, but we are nowhere near Albuquerque. So that's how you can see how wide the gap is of me being the second, and I have 25,000 students, and I'm sure Mallory has 3 or 4 times that number of students. So New Mexico is there's so much rural areas that, the big cities, Santa Fe, Albuquerque, and Las Cruces is pretty much the big cities in New Mexico. So I have a staff of 3. I am the coordinator, and I have what we call specialists underneath me. And we are embedded into the special education department. So I have access to the directors of SPED, and I also have, being a nurse, and we were in the health services department. I work a lot with both of those groups, as well as regular education, the head of the social workers for regular education. So I can work with all different areas, but just the 3 of us are actually the 3 that implement and do all of the day-to-day necessary jobs in order to keep us in compliance with the state and federal regulations. So I am, and both of my cohorts are Medicaid, what they call in New Mexico P determiners, so presumptive eligibility determiners. So within our 3, we were able to do that. Our school-based health centers also have somebody that can do that, and so that has helped. We have my department has been. We send out to families all the time. When we were doing the re-enrollment at the end of PHE, I've been helping families get back onto Medicaid. So we do a whole lot of things and touch a lot of different areas within just our little department of 3 people.
Thank you so much for sharing that. Any particular, just kind of last questions here as we wrap up, as we're getting to that 4 o'clock mark, any specific success stories you'd like to share wrapped around in Medicaid SBS?
Yes, I will having said, for some reason, I had a family with a medically fragile child who, for some reason, was kicked off of Medicaid. Parents were like, how am I going to get oxygen? How are we going to get all the meds? So on and so forth. And through my department, we were able to get her back re-enrolled into Medicaid, give her presumptive eligibility, which gave her that 30-day window of being able to get all of the medications and so on and so forth to survive during that month, and got her right back onto Medicaid. And so, the kids are what are important. And I don't believe anybody here on this panel wouldn't go above and beyond to get whatever, the mental health, anything that a student needed, whether we reach out to the community or we can find that resources within our district.
Awesome. Thank you so much, Elizabeth. And thank you to all of our panelists today here, talking a little bit about each of their different districts, some of the challenges and successes that they've had. We very much appreciate your insights and what you've been willing to share so far. So just thank you everyone today for joining the webinar. We will be providing out the slides and the recording following today's call. Thank you again to New Mexico for joining us and being a part of the panel. We very much appreciate it. All of these items will be made available on the Medicaid.gov website. If you have any questions for the TAC or for New Mexico, please email the school-based services at cms.hhs.gov mailbox, and we will be sharing those along. Thank you all again, and take care.